The patient experiences pain in his right shoulder during his backswing in golf. Upon assessment of the osteokinematic movements, we find that the patient has pain in external rotation and horizontal abduction. The assessment of the joint starts in its maximally loose pack position, which in the shoulder is 60 degrees flexion, 60 degrees abduction, and 30 degrees external rotation. The therapist palpates the joint line with the index finger and fixates with the rest of the hand over the acromion and the clavicle. A pure traction is first applied with the moving hand as close to the joint as possible. The pulling direction of traction is done perpendicular to the treatment plane, which in the glenohumeral joint faces lateral, ventral, and slightly cranial. The therapist asks if the recognizable symptoms are provoked, and if so, where. If the pain is provoked, the capsule is suspected. The therapist determines precisely which part of the capsule is affected by applying direct glides. Before performing the glides, a finger must palpate the joint line on the same side as the glide direction so that the movement is felt. The first direct glide is done parallel to the treatment plane in maximally loose pack position. For this example, the glide will be done in the ventral direction so that the anterior capsule is targeted. This technique can then be intensified by horizontally abducting so that the joint is in loose pack position and there is added tension on the anterior capsule. After each glide technique, the patient is asked for provocation of pain.